All right, so good afternoon, everybody. Thank you for coming to our first ever virtual roundtable. We're excited to have you, and we're excited to have our panelists be able to impart their knowledge about each organization with us. I'm sure that this virtual environment will be just as exciting, just a little bit different, but just as exciting and informational as the ones that we've done in person in the past, and hopefully we can work our way back to getting them in person so that you can get in front of these wonderful employers. We will have each organization provide us with an overview of their organization and then open it up for a Q&A session. I do want to let our attendees know that the organizations that are with us today have also all set up individual Q&A sessions towards the end of October. I'll let you know the dates of those as we close up this session, but they are all in Handshake and they all have individual times that they want to get to know you and hear from you with additional questions. So I will start by introducing our panelists for our first session. And so today we have with us Andrea Morgan with Ascension St. Vincent's. We have Kathy Howard and Dave Wilhoit with Riverview Health, and we have Dave Fetterspill with IU Health. And we want to thank them, give them our attention, and let them tell us all about their wonderful organizations. We're going to start first and change it up a bit from what I emailed you all. We're going to start with our friends at Riverview Health. And then I will have a little 15-minute countdown, and I'll give you a thumbs up, and then we'll just keep this party moving. So I will mute myself and I will give the floor to you all.
Brandy, I apologize. Who are you?
Dave Wilhoit.
Thank you.
There we go.
So we can hear you.
Can you hear me? Everybody?
Yep.
Great. Well, thanks everyone for attending. My name is Dave Wilhoit. I'm the Director of Inpatient Services here at Riverview Health, County Hospital for Hamilton County. We have two hospitals. We have one in Noblesville that's kind of our main flagship hospital. It's 156 beds. We have another hospital that's over in Westfield at the corner of 32 and 31 as you come into that area. And it has 16 inpatient beds. It also has ER urgent care, 3 OR suites, and then some pain clinics and doctor's offices on the 4th, 5th, and 6th floor of that facility. We also have 3 freestanding ER urgent cares, one in Fishers, one at the 146th in Hazeldale and Carmel, and one over at Michigan Street in West Hamilton County. And those function as ER or urgent cares, depending on what you come in with. There's no beds associated with those inpatients. So we can treat and treat from those standpoints. Our main, at the Noblesville campus, we have pretty much a full service of disciplines. We don't do cardiac open heart surgery or transplants, and no neurosurgeries from that standpoint. But everything else, we have a small peds unit, medical surgical beds, ICU, ER, vascular labs, bone and breast, cancer, oncology, infusion, outpatient, and then all the general ORs and things like that. So, Kathy, anything else you want to say from that point?
No, I think, as far as Riverview is, we are the largest employer for Hamilton County. We are also independent of taking tax dollars from people, so we run our hospital on our own accord, and we pretty well stay in the black. And we've been around since, gosh, Dave, how long? in the early 1900s. We located downtown Noblesville in the 50s, and then they moved to the current location, and ever since have been expanding quite a bit. We have about 1,500 employees as an organization goes. We do offer a full host of benefits, and our benefits, of course, would include all the health, vision, dental. We do a 401k. We have a matching program for that. We offer tuition, and we have continuing education and certifications as well that we offer from that perspective. As far as an environment goes, it is such a friendly and warm environment. And you'll hear that I do all the exit interviews and I do a lot of entrance interviews in our organization. And that's probably the number one comment. It's the nicest place I've ever worked. So that's a nice thing to be able to say. But really, Dave, I think one of the great things that you do offer in your area is you offer nurse training programs. And I think if you might want to talk a little bit about some of the shadowing that you've put together and some of the students that we have had that have really, when I'm hearing them leave us, have a great experience there with you. Would you like to comment on that?
Some of the participants may already do clinicals here at Riverview. We have a student nurse extern program, so we'll hire you in as long as you've had one clinical, one semester of clinical, have you work on our med surg and rehab units, and get hands-on experience, start to learn the ways of our unit and our hospital. And then as you go through your training and you graduate, then we'll roll you into a position on one of our med surg or acute rehab floors. We have people come in and shadow during normal times. COVID, we've kind of limited that. Come in and shadow, see what you think about the environment, and pick our brains about things that you may want to know about our hospital. We've had good success with that. We've had good turnouts from that program. It hasn't been going very long, but we do have good turnouts from there.
Yep.
So, yeah, we're always welcome. We enjoy having our students from Marion, and hopefully everybody gets a great experience. So
yeah, we would definitely welcome you to have conversations with us, both Dave and I. And you know, we have direct phone numbers, and of course, if you ever wanted to reach me or go through the organization or find out where you could go and talk to anybody, I'm Kathy Howard. I'm an HR generalist for Riverview Health, and I do offer a direct phone number at 317-776-7436. And we really thank you so much for listening about Riverview Health, and we welcome any visitation you would like.
Thanks a lot. Bye.
Thank you both for that. I am going to pause and see if Shelby is able to hear us with Trilogy Health. It looks like she entered. And if she can hear us, just a quick yes. And they may still be working on their tech issues. And if they are, we'll pause and we will keep going. So Andrea with Ascension St. Vincent's is up next. I will mute myself again, and then you have the floor.
All right. Thank you, Brandy. I'm Andrea Morgan. I am part of St. Vincent Ascension. I have been with them for just over 21 years now in a variety of different roles. My current role is Director of Practice Transformation, supporting the entire state. Ascension St. Vincent, we do have 19 hospitals in the state of Indiana, plus 5 neighborhood hospitals here in the Indianapolis area. Those neighborhood hospitals consist of emergency room beds and some inpatient beds. We go as far south as Evansville. We go as far north as Kokomo, and we really range in size from a critical access hospital, which is a hospital that is in a rural community, licensed for up to 25 inpatient beds. They normally have operating room services. They all have ERs. We do have one that has women's services there also. Up to our largest hospital, which most of you would be familiar with, is the 86th Street campus, which has about any specialty you want with the exception of burn. It is a level 1 trauma center, heart center of excellence, stroke center of excellence. They do a lot of very good work there, cardiac transplants, renal transplants. We do, Ascension is in 11 states across the country. Ascension as an organization hires over 55,000 nurses Ascension wide. A lot of work really happening at the national level to really standardize a lot of the work that we're doing and really make the environment a lot better for our nurses, looking at some processes to improvement. We all know nurses really have been given more and more added to their plate. So what can we do to really help our nurses along the way? As far as Ascension, Indiana, we do have a nurse residency program. It is a year-long program. We will hire you pre-licensure, meaning you do not have to have taken your NCLEX before you start a job with us. We do bring you in all of our nursing staff, whether that's nurses or patient care techs, EMTs, medics. I'll go through a standard onboarding program when they first hire with us, and it's a 4-day program. A lot of that is hands-on, where it's simulation and skills, some team building activities with very little didactic. Our new grads continue in that same learning modality for an additional couple of weeks up front, where they're getting a lot of simulation, again, a lot of skills, and really building on the concepts that were introduced at our regional onboarding center. You're also starting to get introduced to the unit that you were hired to at that time. After that first 4 weeks, you go to your unit traditional orientation with a one-on-one preceptor. We will individualize your orientation. So we want to make sure that you're prepared to come off of orientation and able to care independently for any patient. So while we'll give you a range of what your orientation will look like, certainly that can be shortened or it can be extended based on your individual needs. From there, over the course of the next year, we do offer some extension classes, as we call them, and those are coming back together with other new grads monthly for continuing educational opportunities. That'll range anywhere from end-of-life care to organ procurement to, just how do you talk to the physician at 2 o'clock in the morning? So a variety of different topics right there. We do have other programs within Ascension. We do have a new career coach that we call her. She is phenomenal. And our goal when you come into Ascension is that you stay with Ascension from the time you hire till the time you retire. And there are many, many opportunities for nursing these days. So really, we can take you just about anywhere that you want to go in your career. And how do we get you there? And that is the role of our career coach. So she'll walk beside you and help you get to those, areas that as you advance your career. Certainly when I started off as a very young nurse, I never, ever imagined myself in any sort of a leadership role. Life changes, you grow, you mature, different things happen, and you find different routes for yourself, and we want to help you get there. The other thing with Ascension, as I mentioned, we're in 11 states, so there's certainly opportunity. Should you relocate to another state and you want to stay within the Ascension system, if you're moving to a state where we have a ministry there, certainly working with our partners at our other ministries to help transition you there. I am currently working with a gal who is at Ascension, Wisconsin, relocating to Indianapolis, wants to stay in the Ascension system. We're interviewing her for jobs right now at Ascension, Indiana. So she would maintain her Ascension seniority, all of her benefits that go along with that. Again, like Kathy said, Ascension, we have all of the benefits. That would include all of your health, vision, dental, the 403. We do match also. Ascension is the largest Catholic healthcare organization in the country. Again, like I said, over 50,000 nurses strong in that. So that is a little bit about us, and I would welcome any questions. So thank you.
I'm still not sure if our friends with Trilogy Health can hear us. They may also still be working on their tech issues, which is still okay. We're still going to hold out for them. But I will turn it over to Dan with IU Health.
Yeah, very good. So my name is Dan Fetterspill. I'm a talent acquisition consultant with IU Health. Talent acquisition consultant is another name for recruiter. It's a more contemporary title that you'll be seeing a lot. So I'll walk you through what we do at IU Health, and I'll also discuss the onboarding process a little bit and cover some frequently asked questions. And just a heads up, we are not on a hiring freeze. I think one student at Marianne had mentioned that to a hiring leader, and that's not true. So anyway, IU Health, we are the largest hospital system in the state of Indiana, and we're also one of the largest teaching hospitals. And we are considered a magnet hospital, which means we've demonstrated excellence in patient care and nurse innovation. We have over 34,000 employees statewide, so we have locations in several regions in Indiana, including, of course, Methodist Hospital and University Hospital, as well as Riley Hospital, all in downtown Indianapolis. And we also have Ball Memorial Hospital on Ball State's campus, Arnett Hospital in Lafayette, as well as Riley office in Fort Wayne, and many others as well, like in Bloomington. So I just want to kind of go over some of the steps that we expect for our candidates in the onboarding process. So how this works is I definitely recommend putting out an application very soon, especially if you're going to be graduating in December of this year. September, October are definitely the months where our hiring leaders are going to want to build relationships and start filling these positions. And you can visit our careers website by going to www.iuhealth.org/careers. And from there, you're able to do a keyword search as well as a zip code search to find openings in your area. And so next, what would happen is if you meet the qualifications and you apply for a position that you have an affinity for, a talent acquisition consultant like myself will reach out to you for a phone screen. This is mostly done through email. So try to be checking your inboxes as frequently as possible, including your junk mail, and make sure that you are communicatable. Also what I do recommend as well is have a list of references ready. When you're ready to graduate, maybe speak with some of your instructors, some of your former managers, and some coworkers. They don't necessarily have to be healthcare related, especially if you don't have any healthcare experience yet. That's totally fine. But at least have a list of 5 good contacts and just let them know, hey, I'm applying for this position, I'm interviewing, and they're going to be wanting to complete a reference check soon. So just be on the lookout that they're probably going to contact you. And so the next step of this, if you do meet the criteria, the talent acquisition consultant will be sending your application off to our hiring leaders. And from there, the hiring leaders will reach out to you to set up an interview. Every hiring leader kind of does things differently. Sometimes they reach out through email, sometimes they reach out through phone. So just make sure that your voicemail box isn't full, and just make sure that you are being punctual with time and showing up on time as well. And be prepared to talk about yourself and show compassion and excitement. Try not to be too terribly generic with your questions, and be prepared to discuss specific examples. And most importantly, and this goes for every hospital system that you're interviewing for and applying for, make sure you do research on the hospital prior to the interview. And also make sure that your resume, the objective, is updated that shows the hospital system that you had applied for, because it'd be kind of embarrassing if we saw your resume for an IU Health position, but you had listed that you wanted to find a job in the PACU department with Ascension St. Vincent, for example. So just make sure that you're prepared. And I do want to just go over a few examples of what hiring leaders may be asking in an interview. They'll most likely be asking you, why did you decide on a career as a nurse? And this is where our hiring leaders are looking to spot passion. It's very easy to tell if someone is passionate if they're able to talk about themselves and their careers with excitement. And also another question that they'll most likely ask is, how do you expect to deal with someone who isn't satisfied with your patient care? So even if you don't have healthcare experience, you can still mention and bring up stories and examples of maybe non-healthcare related examples where maybe you dealt with a tough customer. And another question they'll most likely be asking is, how do you handle the stress of the job? So however ways that you cope with stress on a daily basis with work, this is something that we'd like to know about. And I will say that many units are able to hold openings until you pass your NCLEX. So you'd be working very closely with your talent acquisition consultant and let them know of your test dates, if you pass or not. And if you don't pass the first time, many units will hold a position for you until after the 45-day window. You just have to keep us updated. And lastly, what I just want to say is, once you graduate from nursing school, you're going to be a nurse for decades. It's not a bad idea to start off in a unit like med-surg. If you don't get placed into the unit that you have an affinity for, just take it in stride and try again in 6 months. Our policy is you do have to remain in a full-time position for at least 6 months until you're able to transfer out into different units and different patient populations. So just don't rule out med-surg. It's a great stepping stone for nurses to gain those little shallows and those experiences that'll help them pour a nice foundation for their careers. I think that's all I have to cover. Once again, our careers portal is www.iuhealth.org/careers. And also I'm going to list a link in here. If you are interested in getting your foot in the door with us, please visit this website, put in your information. We'll be contacting you very soon. And I look forward to speaking to you guys.
Thank you. I wrote down to make sure to ask everybody if they wanted to put the link to your careers in the chat so that everybody has that, all of the attendees have that link. That would be fantastic. If you don't have the link or aren't seeing the chat and you want me to do that for you, I can do my best to do that for you too. I just sent our partners with Trilogy an email. I'm not sure if they are still having issues or not, but we will continue on. This is going much smoother and much faster than what I had anticipated. So I think everybody loves the gift of time. So we will continue forth with our question and answer session. Bami, before you start, there was one question in the chat that came up, and that was from Rebecca Salem. And Rebecca wants to know, for Riverview, are you allowing shadowing right now?
Yes, we do shadowing right now. Video's messed up again. Sorry about that. Yes, we do allow shadowing right now. We can go through Kathy Howard. She gave you her information, and I can speak directly for the med-surg and the acute rehab units. I don't know about the ICU unit, and I don't believe that the ER is currently. But yeah, we usually do a couple hours shadowing just to kind of get your feet in the door, check it out, and ask questions.
Okay, so I will introduce our president of the Student Nurses Association, Bami Adenua, and she will be asking some questions that the Student Nurses Association has come up with. So I will mute myself again and turn the floor over to you. And I think what we'll do is we'll have everybody answer the questions, and we'll just start as we started this whole session. So we'll start with Riverview, Ascension, IU. Does that sound good? Okay.
Thank you so much, Brandy, and thank you all for coming. Our students greatly appreciate the time, especially during times like COVID-19 where we're not able to interact with you guys. We're so happy that you're able to do something online with us. So first question, I know some people were putting some contact information in the chat, but is it possible for everyone to put their email in the chat? Just in case we have some questions, we can contact you afterwards. Our first question from our Student Nurses Association is, what is it about your company that should draw in new nurses?
Riverview, we're smaller. We're like family. We know everybody. Our CNO, she knows everybody from all over the organization. We all function together. And I mean that in a good way, meaning that we know everybody in other departments. You can't go walk down the hallway and not see someone that you don't know. So we all are there to help. We're all very open. We want everybody to succeed. We want our patients to have the best care, and we want our nurses and our staff to feel like they're having the best work environment to work in. So it really is a good family, good place to start and set some roots.
Thank you.
And I would say for Ascension, it's sort of the opposite. I think each individual ministry, it is very family-like, and we hear that a lot from our nurses that are on our individual units. You go to a hospital like 86th Street, and it is very, very large, and you certainly will walk down the hallway and not see people that you know. I think one of the benefits to Ascension is the fact that we are so big, and there are many opportunities. As I mentioned before, should you need to move out of state for whatever reason, we definitely have opportunities. I think our mission, vision, and values that are instilled in the Catholic healthcare, certainly we hear a lot of our associates talking about that. If you are a faithful person, there's nothing wrong with sitting down with your patient and holding their hand and saying a prayer with them. That's not frowned upon in our organization, and that's something that's very meaningful to a lot of our staff that are the frontline staff caring for our patients. We do open up every single meeting with a reflection or a prayer, so that faith base is very instilled in our culture that we have.
Thank you.
And with IU Health, I will say we have such a large organization. We do a lot of internal transfers very frequently. So this is a great opportunity to advance your career in one organization and just move about the cabin, if you may, once you're ready to take on new skill sets and new specialties. We also have great fellowship programs available for new grads. I know we have one in the OR, as one at Riley Hospital. And we also have a nurse residency program that I'm going to discuss really quick. It's also what we call our transition to practice program. And so ours, it's a great education support system for new nurses. And the benefit is that you're hired onto a specific unit of your choice. And you go through a 10 to 12 week orientation on that unit. And after the orientation is complete, you'll go through a 1 year long program that's designed for new graduates, or if you have less than 6 months of experience. And you meet every other month and meet with nursing leaders and mentors. And it's a support learning group where you're going to have dialogue about educational offerings. You're going to talk about experiences that they've had on the unit. It's going to help with nurse-physician interaction, including conflict resolution, and also career development because of the networking aspect of it. And it's also a great support system to help bridge the gap from students to professional. They also provide emotional support, which we call critical incident debriefing sessions. This is like grief counseling. If you ever have a patient in critical care that you've had for a long time who may pass away, they'll help you with the grieving process. So overall, we're such a large organization. We have a lot of great resources for new nurses to help them in their pathway in their careers.
Thank you. Okay. Our next question is, what are your company's core values and what traits do you look for when hiring a nurse?
Our core values are to provide excellent care to every patient every time. And we truly stand by that. What was I didn't hear the second part of the question.
What traits do you look for when hiring a nurse?
Well, first of all, first impression, be friendly. The patient's in an unfamiliar situation. They are stressed, they're scared, they're sick, they don't know what's going on. And the same way with the family. Personality means a lot to us. We obviously want you to have good basic nursing skills so you can provide safe care, but we want you to connect with our patients, make them feel safe. Safety is our number one priority in everything that we do at Riverview Health. And we not only mean safety for our patients, safety for our families, and safety for our staff. That's what we look at anytime that we look at a policy, what is best practice. Also flexibility, The basic, be on time. I think that Dan mentioned it. Be on time, be prompt. You made it through nursing school. We want you to be a responsible adult and come in and do the things that you need to do. Those are basic things that we look for. Nothing super extraordinary, out of the, no superhero capes needed, but just take good care of our patients.
Thank you.
I'll pretty much echo David as far as what we look for in a nurse. We want to see someone who shows that compassion, who has empathy for our patients. We realize, new graduates, you're all nervous. You've just gone through 2 to 4 years of school. You're not really quite sure what you're going to come out to. So we understand that when we interview our new graduates. You may not know exactly what you're stepping into, and you're scared and frightened, and we totally understand that. But showing that compassion, showing that empathy for those around you, and for our patients and their loved ones that are with them. As far as our core values and the Catholic Healthcare Organization, we really service to the poor, serving all of our people in need and serving them equal. So I very close to what David said. We're probably worded a little bit different, but it's really providing that compassionate care to all of our patients and their families.
Thank you so much.
So as for IU Health, a lot of what we're going to be talking about on this subject is kind of echoed off each other because, we are health systems after all. Our mission, we're guided by our mission to improve health of our patients and community through innovation and excellence in care, as well as education, as well as research and service. So at IU Health, you'll receive the best care available. That's what we want to brand ourselves as. It's also going to be personalized for all specific needs. And we believe in treating the whole person, not just the symptom, and also ensuring that our approach is right for you and your lifestyles. So as of the candidate profile that we're looking for nurses who show urgency to succeed and care for our patients. Again, nothing superhero related, very much echoed of what other members on this WebEx are mentioning as well. But we are looking for nurses who are punctual, who communicate, who can show up and do a good job. And we can typically sense that very well during an interview.
Thank you so much, everyone. Our next question from the Student Nurses Association is, what is the best way to go about scheduling interviews / applying for jobs if you're a new graduate who doesn't know where to start?
I think the basic, easiest way to do it is to go to our website, riverviewhealth.org, and click on the careers section. It will list every position that we have available from that. Also, I provided my email address there, dwilhite@riverview.org. Feel free just to reach out to me, and I will communicate with you via that way and set you up with our manager and Kathy Howard, who's in our HR department also.
For St. Vincent, we're just a little bit different. We do like for our new grads to apply to a single position. Unfortunately, they're having a little bit of technical difficulty getting that position posted. I anticipate it will be posted tomorrow, and I can certainly send that job ID number over to Brandy as soon as I have that, and she can share it with all the students. But it is a single position that is posted, and it is specific for our new grads. We do interview all of our new grads, talk about their areas of interest, and then the HR recruiter will get you set up for an interview on those units. We do that because we want to make sure that we have the openings, we know what those openings are for our new graduates. And rather than going out and applying for an RN position, we have a single recruiter who manages all of our new grads.
As for IU Health, I mentioned earlier our careers portal. It's www.iuhealth.org/careers. And from there, you can do a keyword search and zip code search. My advice for you, once you get a hold of a talent acquisition consultant, or I should say once somebody reaches out to you, it will most likely be through email, like I mentioned. So please be sure you're checking your inbox. And also make sure that you're tracking these interviews. If you are familiar with Microsoft Excel, couldn't hurt to, list who the organization is, what time the interview is listed as, who the talent specialist is, and what is the unit that you're interviewing for. So just keep track of any outreach efforts from anybody from a health system. The first step will be speaking with a talent acquisition consultant, and then it will be the hiring leader that will reach out to you, and then however more interviews that you need until you officially start with us. So I believe that answers the question.
Thank you so much, everyone. Our next question is, what is the biggest or most common application mistake that you guys have seen?
I'd say for me, it's basic punctuation and spelling. The biggest interview mistake that I find is they don't know about the facility or the health system that they're applying for. I will often ask, why do you want to work at Riverview Health? Basically, besides the fact that I have a new grad position open on my med-surg unit, tell me what you know about Riverview Health. And more times than not, they say, well, I really don't know that much about Riverview Health. And that's me. If you didn't take the time to invest and look and find out about the job that you're applying for, that's kind of a turnoff for me. I'm sure people are on their phone, all the time. It's a simple Google search to read everything that I have about Riverview Health on our website. I don't need the nitty gritty, but at least tell me that I'm the county hospital. I have 156 beds, things like that. Basic information. So, and then be on time, communicate well. Those are, it's basic things, but you'd be surprised on people that serve from my desk and I interview that don't do those things. That's my advice.
Yeah, and I'm going to touch on something that was said earlier. I believe Dan mentioned it, but that objective statement that's in your resume. Make sure that you are putting the correct organization. We understand, all of us, I think, understand you are probably going to be applying to multiple organizations, but take that time to make sure when you're submitting that application that you have the correct organization listed on that application. Again, with Technology Day, it's very simple to erase Ascension, and put in IU Health or Riverview or whatever it may be. Take that time. Again, do your research. I want someone, again, to come to me and say that the reason they want to work at St. Vincent is because of our mission and our values, and that we are a Catholic healthcare organization. That means a lot. To do that little bit of research. One piece of advice I would give is, I personally do not feel that you need to list out all of your clinicals. We know where you guys are graduating from. We know where, what hospital systems you've been doing your clinicals in, and we know what areas you've been doing your clinicals. So you certainly do not need to take up that space and add your clinicals in. I like to see, what have you done in your past? Were you a member of a sports team? Because that shows teamwork. Anything. Did you work at McDonald's when you were in high school? There's nothing wrong with that. And again, it shows teamwork. It shows, some responsibility. So those are my pieces of advice for you.
Yeah, I definitely agree as well with all that. I've noticed a few new graduates would not list their graduation month and date, or if they graduated or not. So just make sure that you are listing these small months. It's very important to know, especially if there's a fellowship program that you'd be qualified for. So always mention the month that you're going to be graduating, even if you haven't graduated yet. And also, a lot of the recruiters are going to be looking at the application only. If you're a new grad, if a position requires some like ICU experience, for example, we do like to see patient care advocate or patient care technician experience as well. So make sure that that's listed, make sure that's closest to the top, because that's pretty relevant. And also for when you're filling out the application, some new grads like to put their full name as the employer of their previous job. So we don't know their previous employer. We just have their name, which is kind of sloppy. So just make sure that you are crystal clear with your work history and who you are.
Thank you so much, everyone. Okay, our next question is, what opportunities are there for underclassmen nursing students at your facility?
At my facility, you can come in and work as a student nurse tech. In order to do that, you have to have completed one semester of clinical. You do not need a CNA. I created this position specifically for the nursing student to get them in. I feel like that if they've completed a clinical semester, that they have the basic groundwork from that. They don't need to go and spend the money, take another test in order to do that. Anybody that's not in nursing school that work on my med surg and rehab units are CNAs. So they can come in as a student nurse extern and work, essentially be a CNA minus the CNA licensure. They won't pass meds, they won't do anything that a nurse does, but it will give them hands-on experience to learn the flow and hopefully transition into an RN position when they graduate.
And St. Vincent has something very similar. We do have a student nurse intern position. Again, it is strictly for the student nurse. You must have completed your first clinical. And then coming in, there are varying levels of that, and you do get some dedicated precepted time with an RN. And the other time you are functioning as like a CNA or a patient care technician.
And we have programs like that as well. So for freshmen, we do have patient care assistants as well as tech unit supports that are full-time and part-time. And once you finish your first semester of nursing school, then you can be placed into other supplemental positions. Supplemental is like extremely part-time. Patient care assistants as well. You'd be expected to work at least 24 hours over a 6-week period. And it does require a completion of fundamentals of nursing class in the first semester of clinical rotations. And then from there, you can just keep building. It's mostly going to be a patient care assistant position until you graduate and obtain your license.
I'm going to interject for just a second. We do have a question in the chat that if you have a CNA license already, do you recommend applying for the CNA position or the nurse extern internship positions available at your organizations?
At my facility, it's or because they function same, and they would be in what we call the PRN pool. So that would give them more flexibility to work around their clinicals, their didactic aspect of it. So either one would be fine.
Yeah, for us, I would recommend the student nurse intern position because that will allow you to get your precepted time with an RN.
And ours is either or as well.
Thanks, Rachel, for the great question. Okay, so when should nursing students begin applying for jobs? Specifically, nursing.
I'd say if I don't really have a recommended time. Usually, once they figure out they're going to get ready to graduate, we can slide them in into a student nurse tech position and have them start to learn the charting systems, becoming with that. So anytime before they take their boards.
And if we're talking specifically about our graduating, our December grads, I would recommend applying as soon as possible for St. Vincent.
And I agree with that as well. I do recommend at least 3 months prior to graduation, you should cast a nice wide net with your applications and start that networking process.
Thank you. Okay, so what would make a nursing student stand out when applying for their jobs?
Well, a nice resume. Again, as they said, you don't have to put your clinicals on there. When you actually show up, a professional, see all kinds of people come through, have a resume ready for us, references, professional attire, be on time, and be clear with your answers. We understand you're going to be nervous, so we're not going to grill you, but we do want some nice, clear, concise answers from that standpoint.
And I will agree with everything that David just said. Again, put this stuff on your resume that sets you apart from the student who's sitting right next to you, right? Whatever that involvement in community, sports, school, whatever that may be. Again, we understand that you guys are nervous when you come into an interview, but speak up. Make sure that you're giving answers that are more than just a yes no answer, so that you're having dialogue with the person who's doing that interview with you.
And I definitely agree with these statements as well. The standouts, the candidates that I've noticed are those who list specific examples to questions, whether they're behavior-based questions or situational-based questions. And also just, showing bravery, and being punctual with the time as well. And also, if this is going to be a virtual interview that you have, make sure you dress up and look presentable. Make sure you do your hair. Make sure that you are dressed correctly for an interview. Just because there is a pandemic happening doesn't mean that we should be forgetting our interview important elements. So that's just a little piece of advice from me. And really quick also, if you aren't sure exactly what questions to prepare for, I recommend just doing a simple Google search about common nursing related questions and try to relate those with specific examples to your life and your career path so far. And just practice and be prepared and you'll do fine.
And Dave, if I may, I'm going to tag on one thing. You talked about making sure that they're dressed appropriately. Make sure that you are in an appropriate environment. Don't be sitting on your bed doing an interview. Even if you're sitting on the couch holding a laptop, that's fine. Lounging back on your bed with your laptop open, again, because we're in the pandemic, again, doesn't negate the fact that you need to have some interview etiquette.
I will interject here and give a plug for the Exchange, which is the office that I work in. We do mock interviews. We do a lot of mock interviews for nursing students that are tailored to nursing positions. We also review resumes and cover letters and can help you with all of that stuff. So please use our office for that. We've done virtual interviews. We have tips for virtual interviews and a checklist for you so that you do make sure that your lighting is good. You do make sure that your background is good, that you are checking all of these things off of the list and being as professional as you possibly could be in the virtual environment.
Thank you, everyone. I do have one question. Will the questions be more specific if you're applying to like a specialty? So for example, an ICU nurse will probably have different questions asked during an interview than like a peds nurse, right?
Well, historically, when I worked in the ICU, I would aim my questions more towards ICU type questions. Working in the med surg, especially to a new grad, there's a lot of hypothetical situations that I use. You haven't experienced a whole lot. You have gone through clinicals, but it's hard to give those very pointed questions of like I will, what would you do if cardiac output is this or a patient's doing this, so on and so forth. So for my interviews in the med surg and rehab departments, they're pretty basic ground level questions just to see what build on from that standpoint once we get you in. Make sure you have an understanding. And I'm looking for communication skills, things like that. So at least from my standpoint, that's the way it is for me.
Yeah, and I would say the questions that are probably going to be different are going to be more speaking to why you want that specific specialty area. What experience do you bring to that specific area? And unless you were some sort of a patient care tech, you don't have those experiences to build upon of what would you do in this situation. A lot of interview questions these days are behavioral based questions. They're going to want to know, how do you handle a family that's upset or a patient that's upset with you? How do you talk to that physician who is not being kind to you? How do you speak to your charge nurse? So a lot of those types of questions. I would not think that there's really drastically different questions specific to the ICU for a new graduate.
And I would agree as well with Andrea. ICU will most likely be centered around, well, the positions that you apply for will probably, the questions will be centered around the acuity, especially if they're fast-paced, high-stress scenarios. Like, how do you deal with stress? How would you deal with an angry patient? So just knowing that ahead of time, the urgency, the stress level is something you should prepare for.
Thank you. Okay. Do you have any tips for students who do not know what field of nursing they want to go into yet?
Well, kind of based on what Dan said, med-surg is a good foundation. It's the foundation of everything that you do in one form or another. So I would recommend starting with a good foundation in a med-surg unit. Think back to your past clinicals. What did you get excited for the night before you went in? I used to get excited about ICU. So that's the track that I went down. Not everywhere allows new grads for ICUs. When in doubt, you can't go wrong learning med-surg because that's your foundation. So those are pretty good place.
Yeah, and I would agree with that too. I think med-surg is a wonderful place for our new graduates to start because you do get that foundation. You learn some critical thinking processes. You learn time management, which is so very important in today's nursing world. And you can see a very, very large variety of patient diagnoses on med-surg units. So again, then to progress your care, to progress the level of care that you want to step into in 18 months, 2 years, whatever, after you've got that really good foundation, med-surg is a great area to start with.
Yes, I agree with all of you as well. Med-surg, 100%, and just do it for 6 months. That's our transfer policy. If you don't like it, at least you said you did it. A lot of your hiring leaders and your upcoming units that you'd be applying for, a lot of them did start in med-surg as well, and they'll probably appreciate that you went through that and learned those shallows and built your foundation like that. So yeah, don't rule it out.
Thank you. What have you guys noticed as one of the hardest things new nurses have faced when transitioning into their career from school?
Manage is probably one of the hardest things, and communication. They may know what they want to say, but they're scared to say it for fear they may get it wrong. Those are probably the two biggest things. Time management, you go from taking care of 1 to 2 patients in a clinical setting to eventually taking care on a med-surg unit 5 to 6 patients. And you are now the person that the CNA is coming to ask you questions. That is now your patient that is going bad, that is may need a higher level of care. So it falls on you. So those are probably the biggest hiccups that I see, and which is what a good orientation will help prepare you for the best that you can.
Yeah, and Dave, I feel sorry that you have to go first and answer all these questions. And, Dan and I are just like, yeah, we agree with that. I would agree. I think it's the biggest transition is the reality of what is the day in the life of a real nurse, right? When you get out there and you are managing multiple patients. Time management certainly is something that they are not aware of. I will say one thing that we see for some of those new grads who step into those high levels of care immediately as a new grad is they're not prepared for the emotional toll that it can take and the stress that it can put on them. There's just no way in school to prepare you for that. So something to think about if you really are interested in some of those higher levels of care is just think about the emotional toll. Have that conversation with the leaders when you are interviewing with them of how do they manage that? What is the reality there?
Yeah, this is all very solid advice that I'd like to echo as well. And a good orientation will set you up for success. And also, if you aren't satisfied with your current units and you don't think it was a good fit for you, you can speak with your current supervisor about it. And we do have the ability to put you on a 30-day reassignment or being a priority placement. So we can put you in contact with other recruiters amongst IU Health and maybe find a better fit for you. There are some HR documents that you'd have to go through, which is pretty standard, but it's not a life sentence if you're struggling on your unit as a new grad.
Thank you. Our last question is, what can our nurses expect to experience during their orientation at your facility?
Well, I think it's been extra throughout this whole thing is orientation is the keystone to success. We don't want anyone to fail. Ours is a phased orientation over several weeks. It can be anywhere from 8 weeks to 10 weeks of orientation. You're with a preceptor. We try to keep you with one preceptor throughout that orientation to help build upon. Once your orientation is done, then we try to stick you with the same person that you were precepted with as a mentor so that you have that comfort level. So you have somebody that knows your background and where you kind of struggled and where you excelled, and just have that comfort level, that communication level, that ability to bounce something off of. During the orientation process, also, you meet at least weekly with the manager or the supervisor of that unit, making sure that you're doing well. We have a shift by shift orientation sheet stating the population that you took care of, what went well, what do you need to work on the next time, and what the plan for the next shift is. That way, you have that continuity. If your preceptor calls off or whatever happens to your schedule, the fill-in will be able to look back and have a review of what you've been doing, how you've been doing, and what you need to kind of work towards improving on the next one. So we take orientation very, very seriously. We want you to feel safe. We want our patients to feel safe. And ultimately, we want you to succeed.
Yeah, and we do things very similar. You have a shift-to-shift report that our orientee fills out along with their preceptor. You do meet weekly with your preceptor, your educator, unit leaders get involved in some of that. You do have an off-orientation assessment. So that is combined with the leader and the educator with you to make sure that you are prepared and ready to come off of orientation. Depending on what unit you go to, there are some additional educational classes that you would attend during orientation. So a lot of the very similar things, we like to pair you with a single preceptor. It doesn't always happen that way for a variety of different reasons, but they like to put you with a preceptor. And our educators, I feel, do a very good job of learning the personality of the orientee and matching them with a preceptor who's going to be a good match with them.
Yeah, our orientation is very similar as well, and you may see some similarities with other hospital systems as well, which is a good thing. Right now, our first day orientation is virtual, and then you'll be, doing the hospital orientation, which is and mostly for information purposes, and it's to cover rules, like especially with benefit information. And then you'll go into core orientation, which is like a general orientation for nurses at the hospital. It's what we call our Foundations Week. We get the nurses set up with all their checkoffs, set them up with computers, and then they'll start meeting weekly with preceptors and educators. And once you're finished with core orientation, then you'll be coming on the floor and you'll be ready to start.
Well, SNA, the Student Nurse Association, wants to thank you guys so much for answering our questions. This has been so educational. We're taking away so many good things. So again, thank you guys so much for your time.
Thank you for having us.
Thank you. Good luck to all of you.
Thank you. Feel free to reach out if you have any questions, and I look forward to talking with anyone who's interested in several weeks on the individual calls.
There is a question coming through. I was trying to read it here. when this is for you, Andrea, when somebody applies for that new grad position, what does it look like from there? Like, do they interview, then they talk with somebody, and then they interview for a specific position within that?
They will. So Kala, who is our new grad recruiter, actually is on maternity leave for another couple of weeks. So we have another recruiter who filled in for her for our August grads. She will reach out to you directly, talk to you about your areas of interest, and then get you set up with some interviews with those hiring managers if there's opportunities available on those units.
And then I do have another question. If a student is going to be in an immersion course and they want to submit the job application now, are you able to accommodate an interview around their schedule?
We will always do interviews around. We're not going to pull students away from school to do interviews. If that is the question, certainly we are going to work around any student schedule when we're scheduling interviews.
And I would say that's probably the same for Riverview and IU as well.
Yes, that is correct.
Yeah. Okay. Okay, so this was really, really awesome. Thank you all for your time. I learned so much about your organization. Hopefully our attendees, I know they did as well. I just wanted to give a shout out to your individual Q&A sessions that we set up. This is a 1 hour time slot for anybody to pop in and talk with our recruiters specifically for that organization and that organization only. And so Ascension St. Vincent's will have their hour on the 15th of October from 4 to 5. Trilogy, going to work on them and see what happens. So I'll hold off on that. But Riverview Health on the 27th from 12 to 1, and IU Health on the 30th of October from 12 to 1. And all of that information is in Handshake with the links to the specific rooms for these individuals. And our next roundtable with 4 or 5 other organizations will happen on October 8th. So we will see you then. Thank you all so much again. We really appreciate your time.
Thank you.
And hopefully in the spring, we'll be back in person.
Yes, for sure. Thanks, everyone.
Yes. Thank you.
Hey, everyone.
Thank you guys.